Hello, everyone. This is Dr. Manpreet Khurana again. Today, we are going to discuss a very important topic in pharmacology, which is the dose-response relationship. Whenever we give a drug to the body or we give a dose of the drug, for example, 5 milligrams, 5 grams, 25 milligrams, depending on the drug, there is a response. Definitely, the drug has to give a response. So there is a relationship between the dose and the response. Now, the dose and the response relationship has two components. So it has got two components. The first one is dose plasma concentration relationship, which means we're giving a drug, it has a dose, it goes to the body, gets metabolized, goes in the plasma, blood plasma. So there is a concentration of the drug, right? And the second one is after the plasma concentration, the drug has to show the response. So the plasma concentration and the response relationship. So these are basically the two relationships which we have to understand, right? And we'll be discussing in detail. Now, this topic is very important for exams like AFK, ADAT, even ADC Australia, and NEET dental exam in India. A lot of questions are being asked based on the graphs, so we'll discuss them. Now, let's go to the graph. Now, in this slide, you might be seeing a graph, which is a plot between the dose of the drug, right, and the response. So on the x-axis, we have a dose, and on the y-axis, we have the response. Okay. Now, what is happening on the x-axis is the concentration of the dose is increasing. And on the y-axis, we are seeing that when the 100% response will be achieved, right? So the first graph, which is on the left, this is a type of rectangular hyperbola. Now, if you see, this graph is produced because whenever we increase the concentration of the dose, right, the response is increasing, which is which is actually governed by the law of mass action given by this equation, where E is the observed effect of the dose, right? What is the observed effect of the dose, right? E is the maximal. For example, in this case, this is the maximal response, which is 100%. D is the drug concentration, easy to understand. Kd is the dissociation constant. Dissociation constant. Now, what is dissociation constant is whenever we give a drug, there's a dose, right? The drug binds to the receptor to form a drug receptor complex, right? So the dissociation of this complex is governed by this dissociation constant and is given by the formula half of Emax. Half of Emax. Now, what is half of Emax? That, for example, if 100% is a response, that is a maximum response, when this 50, for example, in this case, it is 50%, right? So this is the, if you plot the lines here, right? So this is the drug concentration at which there is half response received, right? So this value is the dissociation constant, okay? Now, let me tell you that actually what happens whenever a stimulus is given, right? It is based on the fractional change, not the direct change. Now, this red graph is a direct change. Now, you might be wondering what I'm talking about a fractional change. Now, why we are talking about this fractional change is to understand the exact dose-response relationship. The hyperbola graph is not sufficient, right? Because actually in the body, something else is happening. What is happening? There's a fractional change. How this is happening, let's understand. For example, to make you understand, let me give you two values. If I take two weights in my both hands, 1 kilogram weight and a 2 kilogram weight, my hands will easily differentiate. But if I take two weights again, 10 kilograms and 11 kilograms, the differentiation will be difficult. Why? Let's see. Let's understand. Now, if you see the fractional change in the first case, which is 1 kilogram and 2 kilogram weight, is the final value, which is 2 kilogram, minus the initial value, which is 1 kilogram, divided by the initial value, which is 2 minus 1 is 1, 1 over 1 is 1, which is the value is 1. But in the second case, if I take the final value, which is 11, minus initial value, which is 10, divided by the initial value. So this will be 1 over 10. Okay. So if you see, the absolute change is 1 kilogram. From 1 to 2 kilograms, it is 1. From 10 to 11 kilograms, it is 1. But the fractional change is different. In the first case, it is 100% fractional change. But in the second case, it's only 1/10, right? There is a 10% fractional change, right? So similar thing is happening in the body. So to understand the dose response relationship, we have to plot another graph, which is this blue one. This is a type of exponential graph. It is a log dose. So we take a logarithm of the dose, right? And we plot another graph. Now this graph is elliptical, okay? Because it's an exponential, right? So we'll understand how this graph looks like and how to understand the drug response curve and how to solve questions. Now let me just delete all the annotations on this. Till I'm deleting the annotations, let me tell you that whatever we are learning right now, it's very important. And let me just to the eraser. Sorry, I have to use another software. My bad. Okay, so let's go to the most important concept. Okay. Now, if we talk about these plots, now let's discuss. Now, if you see, there are 4 drugs here. Drug number A, drug number B, drug number C, and drug number D. This is a log concentration of the drug, and the y-axis is the response, right? Why we are taking log concentration, we already know, because of the fractional change. Now, in this graph, we will understand there are 2 things: drug potency and drug efficacy. Drug efficacy. Now, drug potency is understood on the x-axis, that how much drug concentration is required to observe the maximal effect or the effect of the drug. For example, if I take the example of drug number D, which is given by this graph, the purplish graph, and drug number A, which is given by the red one, if you see that the difference between drug A and D is that drug D is more potent. Why? Because if you see at a very small concentration, almost 0, there is an effect which is shown. Whereas in the drug A, to show the effect, it starts here. So there is higher concentration is required to see the initial effect of the drug, and the maximal effect is although more, but the potency of drug D is more. Why? Because at a very small concentration, we can achieve the effect, right? But if we talk about the drug efficacy between D and A, if you see, A is at 1. So it is the maximal effect which is shown, right? So, but the drug D is going till 0.62, right? So the effect is like almost 40% less as compared to drug A. So I can say that drug A is more efficacious than drug D. Now, if you take another example, let's take the example of drug A and C. Now, the drug A is showing the effect at this particular concentration, but the drug C is showing the effect at a higher concentration. So this means that drug A is more potent than drug C. And let's see the efficacy. Now, in this case, the efficacy of drug A is also more than drug C. So we can say the efficacy of drug A is more than drug C. Now, if we compare drug D and C, right? The drug D is showing the effect at a very low concentration. So drug D is more potent than drug C. And if we see the efficacy of drug D and C, they are equally efficacious. So I can say that drug D is equally efficacious as drug C. Okay. Now, if we take the comparison between drug B and C, right? If you see the drug B and C, the C is more potent than drug B, but drug B is more efficacious than drug C, right? So C is more potent than B, but B is more efficacious than C. right? So this is a very important concept which you need to understand, right? Because there are a lot of questions wherein they will give you a graph and they will ask you about, which drug is more efficacious, which drug is less efficacious, and potency. This is a question which is also given in dental decks, right? So which is used for a lot of exams, NBD exams for US and all other exams. Thank you. If you have any questions, you can just contact me directly. Thank you and have a nice day. Bye.